This is one of the most exciting times in the history of Mayo Clinic. The impact of our model of care is touching the lives of more and more people in the Southeast and in the nation.
Mayo Clinic has a 150-year track record of leadership and innovation, including 30 years in Florida. During 2016, our 30th anniversary of Mayo Clinic in Florida, we celebrate the innovative spirit that founded the campus and has positioned us to help lead the future of healthcare.
Mayo Clinic is a worldwide leader in patient care, medical education, and research, and we're top ranked for quality more often than any other healthcare organization. In our 30th year, Mayo Clinic was ranked #1 in Florida by U.S. News and World Report.
Through our 3 decades of growth, Mayo Clinic in Florida has nurtured the spirit of innovation with investments in people, space, and technology so that we can carry forward the vision of our founders and also meet the needs of our patients today and into the future.
Like all innovation, Mayo Clinic in Florida started with an idea. The Davis family, patients of Mayo Clinic in Rochester, provided 440 acres of land in Jacksonville.
And that was the start of a wonderful thing. I guess what sticks in my mind is Dad's vision for what he thought could happen, and also kind of today what's happening at Mayo, Florida. And it's hard to believe it's 30 years. I think he would be extremely pleased with what's happened to this campus and what the future is.
So a bold new course was set, a course requiring people with the spirit to carry out this mission and build a new campus in the Southeast. The team of 37 physicians and 150 allied health staff who volunteered for this mission would prove more than up to the challenge.
There was a lot of excitement. The honor of starting a new Mayo Clinic is kind of a once-in-a-lifetime opportunity. It never crossed my mind that we wouldn't succeed. It never crossed my mind that we wouldn't grow, that we wouldn't develop research or develop residency and fellowship programs. So even back then, I could envision that where we are today was where we would be.
We recruited large numbers of allied health support staff, and to see them come here, embrace our culture, develop their skills technically and professionally, and become leaders in our organization has just been a very gratifying experience.
It's clear that we can never accomplish what we've done without phenomenal support from our nurses, our secretaries, our mid-levels at the hospital, the operating room staff, every paramedical and medical colleague. It's a huge team effort in every way.
Research has always been an integral part of our team, starting in trailers and expanding into the Birdsall and Griffin buildings. These pioneers helped lay the foundation for what today are leading programs in their fields, and for national and international resources like the Brain Bank. Researchers made significant discoveries in cancer, Parkinson's disease, Alzheimer's, and related dementias. The 26.2 with Donna Marathon was launched to support breast cancer research at Mayo Clinic in Florida. A vaccine for triple-negative breast cancer was developed. As an NCI-designated comprehensive cancer center, we continue to bring new innovations to patients. Construction is scheduled for a cyclotron and radiochemistry laboratory to make radionuclides for cancer treatment in patients. And Mayo Clinic, together with local providers, launched Jacksonville's first bone marrow transplant program. The campus began to perform liver, kidney, pancreas, heart, and lung transplants, building towards becoming a center that would be a national leader in transplant medicine. We're also collaborating on a new building on campus to make more donor lungs viable throughout the Southeast.
Leo Black, Dick Fleming, James Spivey came together and made a decision that we would do transplant at Mayo Clinic, Florida. Without that decision, without that bold decision, I'm not sure where we would be as an institution. I think it was transformative in our history.
Physicians also began testing an electronic health record for the clinic.
It changed the way we practiced, and it is the foundation of the Plumber Project and how things will change, and the collaboration has been amazing.
Our campus has continuously evolved to support our vision, and our teams have always gone above and beyond to meet each new goal. A new hospital opened on campus with benefactor support, moving 67 patients from St. Luke's to the new building. And the J. Wayne and Dolores Barr Weaver Simulation Center opened to provide a place for hands-on learning and innovation in medicine. Medical education continued to grow for all learners.
One of the pleasures is really teaching. It's kind of giving back, because I remember back to when I was a Mayo medical student. That's all the fun that comes out of it, is that you're passing it on.
By 2016, there were over 200 trainees in 46 residency and fellowship programs in the School of Graduate Medical Education, as well as about 350 students per year trained in 28 School of Health Sciences programs.
We were very successful in being able to start a neurosurgical residency program. At that point in time in history, there hadn't been a new neurosurgical residency started in probably over 15 years. That really changed many things here. It changes the tone of everything you do to be teaching and imparting what we know onto the next generation, and that's what it's all about.
Advances in surgery and telemedicine resulted in significant innovation in the clinical area, and Mayo Clinic in Florida became a leader in individualized or precision medicine, bringing discoveries like genome-based drug alerts into our electronic medical record and whole genome sequencing into the clinic to look for answers within a patient's entire genome. Through regenerative medicine, our teams are using patients' own cellular material to develop groundbreaking solutions. The campus also opened 2 regenerative medicine suites right in the transplant center to move from discovery to translation to application all in one place. And construction is scheduled for a destination medical building to help us transform care for people seeking life-changing treatments in the areas of cancer, neurology, and neurosurgery. Mayo Clinic has a conservative impact of approximately $2 billion in Florida.
When we came to Florida, we knew who we were. We knew what we wanted to do.
Good evening. The mayor described his announcement today as one of the most exciting he has ever made.
The goals, they tell me, is to develop the Jacksonville facility to the point that this city becomes the medical center of the Southeast.
We already knew we wanted to be the destination medical center in the Southeast, and this has been a 30-year journey that clearly is now paying dividends.
My proposition has always been that you can build a building, but the building is only as good as what happens in that building and the people that make it happen. And that's the thing that's always, I think, impressed me about Mayo, is the quality of the staff, the physicians, the nurses. It's been wonderful to see this campus grow.
Well, our patients give us the honor every day of giving us the ability to try and help them. And fortunately, we're successful most of the time. You know, I think the patients have probably taught me more than I've done for them.
There are so many things that we should be proud of. So many patients we've helped, so many individuals who are the next generation of physicians who are providing the same kind of level of care that they learned at Mayo throughout the whole country. A legacy that we have all left for humanity from here on.
Innovation is in our DNA at Mayo Clinic. We'll continue to invest in people, space, and technology, and we'll continue to collaborate with other institutions, companies, and of course, with our friends and benefactors. Together, we'll lead the future of healthcare.